Good morning, everyone. Welcome to our fourth Filipino Nursing Diaspora Network webinar series. For the benefits of our colleagues here, we have started our webinar series last August 2019 as part of the programs of the Filipino Nursing Diaspora Network. It's an organization based in Sydney, Australia, and we collaborate with different Filipino organizations and collaborate with other healthcare organizations as well. This webinar series is an opportunity for our nurses to build relationship and to disseminate their nursing and health-related knowledge. So the main objectives of this webinar is to demonstrate and advance the nursing contribution of our nurses in that area, particularly in the Philippines and Southeast Asia. Second is to support nursing contribution to the region's healthcare and to encourage problem-solving approaches to health priority needs and to provide opportunities for in-depth exchange of experience and expertise within and beyond the international nursing community. I'm now turning over the program to our facilitators, Dr. Suryanto and Dr. Richard Sullivan. Dr. Suryanto is a faculty member of Brawijaya University in Malang, Indonesia. He finished his PhD in nursing at Monash University. Dr. Richard Sullivan is a faculty member of the Central Mindanao University. He recently finished his PhD at Silliman University. Okay, without much further ado, I would like to introduce Dr. Suryanto and Dr. Richard Sullivan.
Good morning.
Thank you very much, Dr. Jerome. Hello, everyone, and welcome to the fourth webinar series organized by the Filipino Nursing Diaspora Network. So our topic today is monitoring the nation's health status by analyzing publicly available health data sets, and will be delivered by Dr. Faye Felicilda Reynolds. Myself, Suryanto, and my colleague, Dr. Richard, will be your host and moderator, and we are very excited to be hosting.
Hello. Hello. Today's webinar will be held for the next 60 minutes. So it will be started with 20 minutes presentation by our guest speaker, followed by 10 minutes commentary from the expert panels, and then question and answer session will be within 15 minutes. For today's seminar, our expert colleagues will be joining us as panel reactors to provide commentary and insights. So let me introduce Dr. June Lebres from Wesleyan University, Philippines. Mr. Ryan Michael Udocado from West Visayas State University.
Yes, sir.
Dr. Ray Akub from Visayas State University. Dr. Jonathan Cura, if he's around, from St. Luke's Medical Center. And last but not the least, Dr. Andy Esiata Irwan from Hasanuddin University. There are about 30 participants for today's seminar, including the persons present today, Miss Dr. Asma Husani. Welcome welcome to this webinar. Dr. Kosrini Kadar, welcome. Dr. Apple Sima and Dr. Mayela. Mayela. So thank you for coming. Back to you, Dr. Suryanto, to discuss the relevant session protocol.
Okay, thank you very much, Dr. Richard. So before we go further, I want to review the functionality Zoom platform. Your active participation is important throughout the session. Right now, I have everyone on mute to avoid background noises that may distract you from listening to the webinar. Throughout the presentation, someone staff will be managing the chat functionality. You can enter your question and comments in the question box throughout the presentation, the chat session. If you would rather ask in person, you can also use the icon on the control panel to raise your hand to indicate that you have a question. Once you raise your hand, someone will unmute you, unmute your line so that you can ask your question.
Okay, thank you for that, Dr. Sorianto. So, without further ado, let me introduce the speaker. Before we start, I would like to introduce Dr. Faye Felicida Reynaldo. She is currently an adjunct nursing professor at Missouri University and American Centennial University. She has more than 13 years of experience in the nursing education in the Philippines and in the US, including associate professorship at Missouri State University and University of Hawaii at Manoa. Her teaching expertise includes the three P's: pathophysiology, pharmacology, and health assessment, and nursing research and translational research and evidence-based practice. Dr. Rinaldo's research and scholarly expertise includes the teaching and learning issues in nursing education and immigrant health, especially in the immigrant health issues among Filipinos. She also writes continuing nursing education articles in the Nursing Pharmacology for MedSurg, Nursing Journal, and the official journal of the Academy of Medical Surgical Nurses. Today, she would like to talk about is the monitoring the nation's health status by analyzing publicly available health disease data sets.
Before I hand the mic over to Dr. Reynaldo, I hope that she has a good connection after this. I have a few housekeeping items to cover about this presentation and the webinar platform. The first one, today's webinar will be available after the live session and is accessible on YouTube. We will send you a link to the recording of this event so that you can share it with your social networks. Next, we'd love to hear from you during today's presentation. And last, we'd like to encourage you to share today's webinar with your social networks. So I do hope that Dr. Reynaldo have a good connection now. So without hesitate that I would like to kick things by welcoming our guest speaker, Dr. Reynaldo.
Hi, everybody, and thank you for attending this webinar. And my presentation is about monitoring the nation's health status by analyzing publicly available health data sets. I'm your speaker for today. I'm Refe Felicilda Reynaldo, and if you would like to contact me in any way regarding this presentation or for collaboration or consultation, I have my email address that is available in this webpage. So the learning objectives of this presentation is to first help you identify or describe what are publicly available health survey data sets. And then second, we're going to list at least 3 publicly available health survey data sets available in the United States or other countries. And third, to identify findings from a recently published research article on U.S. Filipino health behaviors related to complementary and alternative medicine. And to be specific, this study actually used the publicly available health data sets. So again, as I said, I'm Dr. Faye Felicilda Reynaldo. I do have 15 years experience as a nurse, but I have been a nurse educator for 12 of those 15 years, both in the US and in the Philippines. I have been a researcher for about 10 years already, and my scholarly and research expertise is in teaching and learning issues in nursing education, immigrant health, especially among the Filipino diaspora. So I've started in the Filipinos living in the US, but I would like to expand that in the future. And I also write nursing pharmacology continuing education articles for MedSurg Nursing Journal, which is the official journal of the Academy of Medical Surgical Nurses. So some disclaimers: I do not have any conflicts of interest to report, and my opinions are of my own. They are not endorsed by the organizations that I'm affiliated with or any other organizations that will be mentioned in this presentation. Okay, so let's start. So first, our first objective is for us to be able to describe what are publicly available health data sets. So if you just look at the phrase, it's pretty obvious what I mean. It's a data set, which means this is data collected and already entered maybe in a spreadsheet ready for analysis. They are on health topics and they have been made publicly available, which means that anybody of us, either you're a researcher, a nurse, whoever, can be able to download this data and use it for themselves. So who then collects this data? It could either be government or other organizations, like for example, health organizations. So government, sometimes they do demographic health surveys, and then they make it available for use by the public. Or it could be, for example, organizations like American Hospital Association, or American Heart Association, or American Diabetes Association. Maybe they did national surveys on patients with cardiovascular disease, and then they compile all of that data, put it in a spreadsheet, and then make it available for other people to be able to use it. So one of the main things that you have to note about these publicly available health data sets is that they are de-identified and delimited. So let's talk about that a little bit more. Okay, so when they make the data set available, first they have to de-identify it. What do you mean by de-identification? It means that they have to scrub off any identifiers of the participants. That is to protect their confidentiality. So in no way should we be able to figure out, oh, who answered the survey, right? So that's what you mean by de-identification. We cannot link the identification of the participant when you look at the data set at all. Okay. And then the second way is to delimit it. When you say delimit, the purpose is still the same. It's related to confidentiality, protection of privacy and confidentiality of the participant of the survey. Delimited means that they don't give out all of the data that they've collected. So sometimes they've already either recoded some of the data so that they're in much more, they're clumped together in limited categories compared to maybe making it like a continuous variable. Or alternatively, they may decide that there are certain variables that could still link the response to a certain person, and we may still be able to identify them. So a very common example of delimiting your publicly available health data sets is to not make the race and ethnicity available to the public. So I know of several data sets that when you want to look into race and ethnicity, you're going to have to go to the actual organization and request it because you cannot access it for yourself. But if you do not need that race and ethnicity, you can have the data, just download it from the website. So these health data sets are usually really large data. The purpose of them collecting the data is to actually to monitor the health status of the nation. So they want to be able to see what's happening among the populations and see if there are any trends and changes. What are the most common illnesses? So is it from infectious disease to now more chronic illnesses? They can find that information from these health data sets. And so with that, when they analyze the data, they can be able to determine necessary health policies to implement so that they can improve the health status of the nation. So a very good example of how your publicly available health data sets can be used is in the US, they have a program called Healthy People. So Healthy People, it's been running for about 3 decades now. So it started with Healthy People 2000 and then Healthy People 2010, and now they're on the Healthy People 2020. I'm not sure if they're doing the Healthy People 2030 because, I think they're in that process now. So your Healthy People 2020 is a program that's been launched by the U.S. Department of Health and Human Services in December 2010. And so by using the publicly available health data sets, the surveys that the government collects, they can be able to track about 1,300 objectives, so health objectives. These objectives are like, what are health priorities in the US? What do we want to show that we are actually a healthy nation? They are in 42 topic areas that are very important to public health. So some topics include access to healthcare, mental health status, oral health, physical activity, cardiovascular health, etc. So there's 42 topics in total. Your Healthy People 2020 also has a subset of those objectives. So specifically 26 objectives in 12 topic areas that are considered leading health indicators. So the leading health indicators are the high priority issues by the US that I think these are the ones that the US has been plagued with, that they're still considered unhealthy, and they want to move it towards a trend of healthy practices. So let me show you an example of how they actually use some publicly available data sets to be able to monitor the health status of the nation. So here on this left side, you can be able to see that they have your leading health indicators. And one of the major topics for the leading health indicators is access to health services. So they are very much concerned about how many people have medical insurance, access to medical insurance, and then how many people are actually visiting a usual primary care provider. So do they have their own provider that takes care of them on a regular basis? And then here on the right, they present to you different information from the health surveys regarding, for example, again, as I said, it's very important for them to monitor how many people actually have medical insurance. And so they present infographics regarding, for example, how many people have health insurance according to their educational attainment. So you're looking now at social determinants of health, which includes educational attainment. And so if you will notice, the the percentage of people who have health insurance starts to dwindle down the lower their educational attainment is. So those with an advanced degree are almost 100%, they have a health insurance, but once you get to less than high school, then it's only about 67%. But aside from that, the one that I really wanted to share with you is this part over here that, okay, let's see if I can be able to spotlight this one. So you can look at the data source over here. Oops, sorry. I was trying to, it's over here, the draw. So over here on the data source, you can be able to see that they took this information from the National Health Interview Survey. So the National Health Interview Survey is actually an annual survey that the government collects. And this data set is available publicly through CDC, or the Center for Disease Control and Prevention, for us to be able to analyze by themselves. So this is a very good example of how publicly available health data sets are used to monitor the status of the nation. Okay. Let me move on to the next slide, if I can be able to do so. Because I lost my mouse. Where's my mouse? Oh, there. Apologize. I apologize about that. Okay. Okay, so to continue, so this publicly available health data sets are available for secondary analysis. So secondary analysis means that you're going to do additional analysis that has not been done before regarding health topics that are available in the publicly available health data sets. So why can you do a secondary analysis with this data set? Well, first and foremost, the data sets that are publicly available have multiple health topics of interest to researchers. So in 1 year, one time I actually did an analysis on a 1 year survey data, and it had 425 variables with about I think there were like 400,000 observations. So 425 variables. The thing is that not all variables are of interest to the organization who collected the data. So what they do is that organizations, they have limited resources for data analysis, or they may just be interested in a few topics, but then because they have been given a large funding, usually by the government or by their own donations, they collect more data than necessary, or more data than what they're interested in. And so with that, they only analyze the ones that they really care about. So I'm interested in knowing about the access of healthcare of the whole nation. And usually they like to make it broad, like the whole nation. But then they may not be as interested in studying about a subset of the nation. So like, for example, just the Filipinos. They may not be as interested in that. And so in that case, there is that potential or opportunity to be able to do secondary data analysis from this large data set, since we're getting data from a large population. Governmental agencies are also bound to actually make it, are required to make the data sets publicly available, because technically the money that was used to collect the data or to do the survey was from the taxpayer funds. And so researchers who usually have limited funding can be able to access this data because the taxpayers already paid for it. So again, as I said also, that by making the data set publicly available, it allows researchers to conduct secondary studies beyond the organization's capacity or interest. So most of the time you will find that secondary analysis of these data sets are usually for a subset of a population, or to monitor other patterns of data that are not really as interesting to the government public health policies. Okay. So the science of having the publicly available data is part of the Open Science Initiative, or the Open Access Initiative. So I think a lot of us already know what is an open access journal. And so this is kind of related to that, except that you have now the data sets that are available. I've had the opportunity before that I was invited to submit to an open access journal, and they told me, well, do you want to dump your data set here to make it publicly available to others? I didn't like the word dump, but I understood what they were doing. This is now what you call an open science initiative, or open science data, wherein they allow you as a researcher who collected the research, the data, especially if you have been funded by the government, to make it available to other researchers so that they can do secondary analysis, or to be able to verify your scientific claims. Okay, so this is is a type of open data that is focused on publishing observations and results of scientific activities available for anyone to analyze and reuse. So you're making your data set available. There are benefits to this. So first is that you are improving or enhancing the external validity of your research, because they can be able to duplicate your findings. And so this will verify your scientific claims. They can also be able to replicate your study and also make comparisons on a subset of the population. Alternatively, some publicly available health data sets can also be integrated. So sometimes two surveys are connected to each other. You can be able to connect them or merge those data sets, and then you can be able to discover more patterns of new knowledge. So our second objective is to actually talk about, to introduce you to some publicly available data sets in different countries. So I have 3 countries that I would like to talk about. So the USA, which is the one that I'm most familiar with. So most of the publicly available health surveys in the USA come from the CDC's National Center for Health Statistics. So if you will notice over here, they actually have a lot of surveys. So the most common ones that are being used for publication, for secondary analysis and publication, are your population surveys. You have your NHANES, your National Health and Nutrition Examination Survey. My favorite, which is the National Health Interview Survey. I've used that a lot, or I've used that, the sole one that I've used. Another one that they do in CDC, which is not under NCHA, HS, is the BRFSS. And the BRFSS is, I can't remember the full name, but it actually is, it monitors the state and national level data on health behaviors. So that's also a very interesting data set, and I have colleagues who have been using that data set to be able to analyze data. Okay, so in the United Kingdom, they have data.gov.uk, and so this one you can be able to determine, they have multiple data sets there. If you click on health, you're going to be able to find some data sets related to health. And then in Japan, they have data.go.jp. And again, these are also some governmental data sets. So I actually downloaded the one from the Ministry of Health, Labor and Welfare. And unfortunately, I cannot be able to read this, but there are some available data sets from Japan. Okay. So as I said earlier, I actually did several studies on secondary analysis of the National Health Interview Survey, which is my favorite survey to use. The reason that it's my favorite is because if you remember, I mentioned earlier that one of my interests is immigrant health, and specifically for the Filipino diaspora, although I kind of expand it to any kind of immigrant. So the National Health Interview Survey is an annual survey on non-confined. I don't think that's a good word. I can't remember the actual word that they use, but it means that these are people who are not confined in like long-term care facilities. It's an annual survey. It's a randomized survey. And the thing that I like most about the National Health Interview Survey is that they have a question for immigrants. You can be able to determine whether a participant is an immigrant or not. So you can have 3 levels, which is U.S. citizen born in the U.S. You have a U.S. naturalized citizen, which means that they were immigrants, but then now they are U.S. citizens. And then you can have a level of non-citizen. So that's my first, interest. That variable is my major interest. My second interest is that they actually have a subset of Asian Americans, and one of their subset is Filipino. So you could actually just pull out and just look at the data just for Filipinos. So in some of my studies, I've actually had to filter to just look at the Filipino population. Okay, and so this is the study wherein I was able to do that. So I was able to look into the US Filipino adults' patterns of complementary and alternative medicine use and medical pluralism. So when you say medical pluralism, do they actually use both the conventional medicine, which is the modern medicine, and do they use also complementary and alternative medicine at the same time? Okay, so this was a secondary analysis that was conducted by me, who was the primary investigator, along with my biostatistician, Soyoung Choi. This was published in 2018 in the Asian Pacific Island Nursing Journal. I do have a link to the full article, so please click that link if you want to read the article. This gives you a really good presentation about the methodology of how I actually use the publicly available health data sets. So this study was partially funded by the National Health Institute, specifically the National Institute on Minority Health and Health Disparities. So my research purpose was to explore patterns of CAM use. So I did a very exploratory study because not many studies have been done on the Filipino diaspora and their health behaviors. And so I really wanted to understand, do Filipinos use CAM even when they're in the United States? And do they combine this with your conventional therapies? So this, the specific data set that I used was the 2012 National Health Interview Survey. Now, do note that whenever you do whenever you do analysis of the publicly available health data sets, it's actually good to do more years. So like, for example, 2011 to 2020, if you can do that. The purpose of that is you're actually solidifying your results instead of just sticking to just 1 year. The things that you can look into for your data sets is that first you can look at the prevalence. So prevalence of diseases, prevalence of a health behavior, etc. So that's the major epidemiological tool that you can use whenever you use this cross-sectional publicly available health surveys. For some studies, they are done on a yearly basis, sorry, or sometimes they're done like every 2 years or every 4 years. So then you can look at trends. So in this specific study, I did want to look at trends, but I couldn't do it. Okay, so let me just give you a background about the specific survey module that I used. So there is the 2012 National Health Interview Survey, which had multiple topics. But then starting from 2002, the National Center of Complementary and Integrative Health, or your NCCIH, they gave extra money to CDC or your NCHS so that sorry, so that they can be able to assess, so that they can be able to add survey questions so that the National Health Interview Survey can assess complementary and alternative medicine health behavior patterns of adults and children. So they started that in 2002, but of course, due to limited funds, they could only do this every 5 years. So they did this in 2002, then 2007, then 2012, and then the latest, I believe, is 20. So the purpose of this study was to explore the patterns of complementary and alternative medicine use and medical pluralism practices of Filipino adults who are living in the US. And the specific data set that I used was the National Health Interview Survey, specific to the year 2012. So let me give you a background of this, okay? So specifically, I was interested in complementary and alternative medicine. The National Health Interview Survey is an annual survey, so every year they collect that data. It's pretty, pretty broad, has a lot of medical topics, and sometimes the survey questions are actually sponsored by a specific center in the National Institutes of Health. So the complementary and alternative medicine questions, survey questions, was sponsored by the National Center of Complementary and Integrative Health. Of course, they have limited funding also, so they can only add their survey questions every 5 years, starting in the year 2002. So they had 2002, 2007, 2012, and I believe the latest was 2017. So when I looked at the data set from 2002 and 2007, I really wanted to look at the prevalence of health behavior patterns. So just to clarify, when you're doing this health, when you're doing this health interview, I'm sorry, when you're using publicly available health data sets, it's a cross-sectional survey. So either annual or maybe biannual, or so sometimes every 4 years they would do that, or sometimes they do it like every 6 months. So it's a cross-sectional survey, and the epidemiological tool that you can really be able to quantify from this data sets is prevalence. So prevalence of a disease, prevalence of a health behavior or a health practice, etc. Additionally, if you want to look at multiple years maybe, or multiple surveys of the same type with the same question, you can look at trends. So at first I wanted to look at trends among Filipinos. However, when I looked into the 2002 and the 2007, it was a time wherein there was no, I believe, law that stated that you could break down Asian American to different ethnicities. So it used to be that Asian Americans were just compiled together: Chinese, Japanese, Filipino, Asian Indian, etc., etc. But starting 2008, I believe, or 2009, they started breaking down the Asian Americans, and then specifically the National Health Interview Survey actually has four levels of the 4 categories of the Asian Americans. So you have the three highest population among Asian Americans is Chinese, Asian Indians, and Filipino, and then other Asians are compiled together. And so because of that, and also because of the fact that when I analyzed this, 2017 data was not yet available, I was stuck to only looking at 1 year. So only 2012. I decided that I can only do a 2012 analysis of the data, which served really well, because again, this was an exploratory study. I wanted to look at what are the patterns, or what's the prevalence from that 1 year cross-sectional study. Okay, so here are my findings. So I had several research questions, because again, I was just looking at patterns. So first, I wanted to look at what are the most common complementary and alternative medicine therapies that are used by Filipino adults in the United States. So you will find that Filipinos like to take multivitamins and multiminerals, and then next is herbal supplements. And then you have chiropractic, massage, etc. The thing with the massage, though, is that it doesn't really differentiate between going to a hilot or just regular massage therapy. Alternatively, your hilot could also be considered traditional healer, which shows here that only 1.3% of Filipinos in the United States are actually going to a traditional healer. Do note that the traditional healer are very, there's different ones. So you have your American Indian, medicine man, so it's not specific to the Filipinos. So you kind of have to make sure that that is a limitation of your study, that it may not be the type of question that you're really wanting to ask. Okay, so I also looked into what are the most common types of health conditions for which Filipino adults use CAM for treatment. So if they're using CAM to treat a disease, what type of disease is it? So they're usually pain-related conditions were the highest, which is 3.1%. And this is pretty common also because in the general US population, pain-related conditions are the most commonly cited reason why they use CAM to treat their illness. What's the most common reason Filipino adults use CAM to treat a health condition? Because about 16% said because it's natural. So there's no chemicals involved, so it's safer, I guess. And then for about 15% because it's a holistic therapy. And then another question was, where do Filipino adults get their recommendations for CAM use? And about the same, 8.7 and 8.6%, they get their recommendations from friends and family members. And when I did a follow-up study of in Hawaii regarding, where do they actually get their recommendations? And this is pretty much common, the friend and the family member. You have a family member, you see a family member maybe taking like, for example, MX3 or Pito Pito Tea. And they're like, oh, what's that for? It's like, oh, I use this for my arthritis or blah, blah, blah. And then they're like, oh, maybe I should try that. And so that's how you get into complementary and alternative therapies. So if you would like to read more of that article, I did have a link to the full article. I also have another secondary analysis article that was just recently published in 2019. This one is not so much immigrant health, but definitely Asian American. So a national survey of complementary and alternative medicine use for treatment among Asian Americans. So this was published in Journal of Immigrant and Minority Health. I don't think this is actually like published in the journal yet. This was published online. So if you click on this link, this will give you the full article. Unfortunately, you cannot print it because again, it's still published online, but I could share that with you. Okay. I do have other projects that are under peer review right now or being submitted. I was trying to look for my YouTube presentation of delayed dental utilization, but I couldn't find it on time for this presentation. Okay. So since I will be presenting this to Filipino audiences or Southeast Asian audiences, I was just curious, does the Philippines have publicly available data sets specific to health? So I had to look around and I was wondering. And so I found the Philippine Statistics Authority. Now, Philippine Statistics Authority, that's also where it's related to where we get our birth certificates and our marriage certificates and the CENOMAR, etc. But they also collect data for the census also. So I looked at the Philippine Statistical Authority website and they indicated that they do collect that the government does collect surveys from the population. So if you look at family and health surveys, they have the National Demographic and Health Survey, which was last collected in 2017. It seems like it's a every 4-year survey because it's 2013 and then 2017. They also have a family health survey, which I don't know if it's the last one was in 2011. So they do have surveys, but when I tried to look for the actual data set in their website, I couldn't find it. So every time I downloaded something, they had Excel spreadsheets, and I was like, oh, maybe that's it. Because usually when you see it, it's either in an Excel spreadsheet or a CS, comma separated values, which is still a spreadsheet technically file. And when I downloaded it, it was just, bar graphs and pie charts, and then I was like, oh, it's not available. So I was a bit sad about that. So most of the time, if you see any downloads there, it's really just going to be reports of things that they were interested in. So I was trying to figure out, well, can we be able to download it? I'm not sure. I don't think so. Maybe if we have connections in the Philippine Statistical Authority. So are there ways to access this data sets? Well, I can give you some answers to that. It's possible. So again, as I said, maybe if we have connections with the Philippine Statistical Authority. The reason for that is that when I was living in Hawaii, the Department of Health So are there ways to access these data sets? Again, as I said, possibly. So first, it could be that if you have connections in the Philippine Statistical Authority or the Department of Health, whoever is collecting the data, that you could be able to work with them to analyze the data. I'm just talking about experiences from my colleagues who had to go to the Department of Health. So like in Hawaii, the Department of Health collects the BRFSS data for the state. And so what they did was that if you want to access specific data, like for example, race and ethnicity, you're going to have to work with their analyst. And their analysts are going to be the one who will be the primary investigator. You're going to be a co-primary investigator for the study because you gave them the research question. But because they're the only ones who can be able to access the data, they have to also be a primary investigator because they're doing the analysis for you. But in that situation, you also have to bring your own statistician. So technically, they're co-primary investigator because of the fact, the people from the DOH are co-primary investigators because they are the ones who have the actual access to the data, and they have to be the one preparing the data. And then also in some countries, like in the United Kingdom, I've found some studies wherein they were able to access data sets and analyze them through a request by the Freedom of Information Act. So I believe that the president in the Philippines have signed the Freedom of Information Act. And so they actually just put you need to know what the data set is to be able to make a request. And so they submit a form somewhere. I don't know which office it will be in the Philippines, but whoever processes Freedom of Information requests, I guess. And then you have to state there that you would like to access these data sets. You have to name them, and potentially they're actually still going to delimit it for you. You may have to actually give them a data analysis plan so that you can be able to show what your variables are of interest are, because then those are the only variables that they're going to give you in a data set. I can teach you that in a workshop later on. Okay, I just have a few tips regarding developing randomized health surveys and also analyzing the health surveys. So sometimes if it's not available to you, the publicly available health surveys, maybe we need to create one. So I know in the US, there's not much done. There was one Filipino community survey which had a few questions, but this was done in like 2001 or 2002. Ever since then, they haven't done anything, probably because they don't have any money anymore. But it's a little bit tough to do this because you need a lot of expertise, especially when it comes to sampling and statistical analysis. So the first thing that you need to do if you're going to develop a randomized health survey, such as the one like National Health Interview Survey, first you need to understand the population census, which means that you need to actually understand, well, how many males and females, how many are, how many lives in the urban and the rural, and stuff like that. The reason for that is you have to prepare for sampling. You need to prepare for sampling. You need to be able to determine, well, do I have to oversample this one? What's the percentage that I can be able to get, to randomize, randomly invite and, get people for this survey. So like in the US, you have to do, they have to oversample the Asian American population and the Native Americans and I believe Native Hawaiian and Pacific Islanders, because of the fact that there's such a small population. So you kind of have to oversample. So another thing is you need statistical expertise for this because these are considered complex surveys. So aside from the fact that it's randomized, they also the randomization is by stratification. So they stratify and then they also oversample. And to be able to get a more accurate inference towards the population, they actually use weights. And so it's the statisticians who actually develop the weights so that we can be able to analyze it properly and infer the results towards the population level. And of course, you're going to need to develop a lot of questions. So you have to think about, well, what are your priority topics so that you can be able to develop your questions. So if you're going to try this, I probably would say maybe start it at a barangay level and then, kind of like work your way up. So like one barangay at a time and until you have like a city or a town, if you have to do this. But then again, you have to always consider these things. Population census, statistical expertise for stratification and oversampling, and then also having your priority topics on health. If you are going to analyze publicly available data sets, things for you to think about. So you have to develop your research question. As much as possible, do not go far from your research trajectory. Especially if you're a tenure leading faculty, it's very important for you to stick to what you actually know or what your expertise are. I do have some colleagues who work with this large data sets, these publicly available data sets, and they do it the other way around. They look at the data variable, the data sets and the different variables, and then they develop a research question. There's nothing wrong with that, but if you have more freedom to do so, then that's what you would do. But if you have a topic, a specific topic of interest, then you have to kind of stick to it. So like for me, when I was in a tenure track and in my tenured line, my interest was really on complementary and alternative medicine practices of immigrants. And so I stuck to those. And that's why I had those articles related to complementary and alternative medicine. So it's also very important for you to understand the metadata. So metadata means that these are the information behind those questions. So what is it really talking about? What are the different answer options, etc. So usually the publicly available data sets, they come along with a code book. So the code book is very important for you to study because you can be able to see the different list of variables, how the survey questions were worded, and then what were the different options, answer options for those surveys. Very important to review because maybe later on you may need to recode those variables because you don't want the actual answer options. You may just want like a yes or no kind of thing instead of this multiple categorical levels of a variable. Okay, so for me, I usually develop my research questions first, then look at the code book, and then determine if the data set can be able to help me answer my research question, because if not, then usually I conduct my own study because I would like to explore more about it. In some cases, again, if you're like my colleagues who do it the other way around, they may just modify the research question and say, hey, this doesn't work, but this is close enough. So they usually do it. You also have to determine if recoding is needed. So recoding means that sometimes you have to combine or separate certain variables. Most of the time it is a merging instead of a separation. So this is this one is under my methodology in that article that I presented earlier regarding how I actually combined multiple questions to be able to develop my research questions. So if you would like to read more, it's found in my article specifically for the methodology. But this is my table regarding how I recoded things. Okay, and then another thing that is very, very important is that you can't just analyze the results using just the regular statistical modules like an SPSS, R, or SAS. You actually have to use the complex survey analysis method found in those statistical software. So sometimes it's not available in the basic SPSS, for example. You actually have to have the full version of the SPSS to be able to use the complex survey analysis method. So maybe later on, I've been talking to Professor Babate about this, maybe I can be able to do a workshop on how to do a basic analysis using the complex survey analysis methods. So very important to notice that when you do the complex survey methods, the descriptive and inferential statistics that are being done here are actually already rendered at the population level. So meaning all of the interpretation are going to be at a population level. So for example, your descriptive statistics will not be mean or median and your standard deviation, but instead it will be a population estimate, so always on a percentage basis, and then standard error and confidence interval instead. And then for your inferential statistics, the most common that you usually use for this is logistic regression. Like if you want to predict certain variables to an outcome, what they will be providing you will be odds ratio. And then lastly, of course, you have to review your results against published literature if it's possible. So in one of my studies, I've actually had to remove some variables of interest. So like, for example, I looked at diabetes, but what they said was that in this population, diabetes was only like 2%. And I'm like, that's not possible that it's only a 2%, only 2% of the population has diabetes, because that's not what's said in the literature. So I actually had to scrub that off from my data analysis. I'm like, I'm not going to include that in the data analysis because it's inaccurate. So you kind of have to think about it a bit more. So my challenge is that if they are available, pursue doing secondary analysis of national health surveys. The reason for this is that you don't have as much resources. The only thing that you need to do is be able to know how to clean the data from the data sets, download it, clean up the data, recode, etc., and then analyze it. So your resources are more either Excel plus your statistical software, and maybe, consultation with a statistician, but you will have very rich data because again, this data is already prepared for the population level inferences. If it is not available, then maybe we should start exploring ways on how to access readily available data, but probably only available to a certain sector of the government. So maybe we should start thinking about, well, maybe we could do requests for freedom of information. Or maybe we should determine how we can start developing surveys that could help monitor our nation's level. So again, as I started, start at the barangay level, then your city or your town, and then province, and then national. Okay, so again, thank you so much for being part of this webinar series, and I'm so happy to be invited for this. If you do have any questions, don't hesitate to contact me. I am also available via email, or I also have Facebook, but usually that is for my family members. I would like to invite you to collaborate with me. I am free to collaborate with local researchers on topics which include nursing education and public health. So I am also very interested in immigrant health, like for example, the health of our Filipino domestic helpers. That's quite an interesting topic for me. I'm also available for consultation and speaking engagements. So for this year, I will be traveling back and forth to the Philippines. So if you would like me to go to your university or your areas to be able to speak, I'm happy to do that. I also do research consultations. So again, I'm very excited to be part of of this webinar series. Thank you so much for having me as a speaker. Oh my God.